How about now? All right. Okay, so I'm working in sort of the mindset of Toksen, okay? And I'm interpreting Toksen as using tools in the Thai yoga, okay? Adjuncts, tools that are complementary. Now, I've said this before, I'll say it again. I am a traditional practitioner, but I'm not a Luddite, okay? Luddite means against technology, okay? Anti-technology. I'm not anti-technology. In fact, I'm pro what I call the right use of technology. I think that the genius that we need to be promoting and exploring and in engineering sciences and technology is in the health sciences. I think that's where it should be. And not just in coming up with increasingly more expensive diagnostic methodologies, but actual tools for healing, okay? And so I'll use electronics. I use electronic devices. I use any device that mimics natural energies. Devices like far infrared that focus and mimic sunlight and the effect of light on the body, using infrasonic and vibrasonic technologies, using sound. The Tibetans started it with the singing bowl, using sound as a healing technology, and actually not just playing the singing bowls, but using the singing bowls on the body, so that the sound is what is actually the therapeutic stimulus, is the sound, and then actually putting the bowl on the body and the vibration of the bowl, the physical vibration of the bowl actually being a therapeutic modality, okay? But it requires a Tibetan singing bowl, and it requires that you use both hands to operate the bowl, and that's okay, and maybe you get tired, all right? But there are also other simple technologies that can be just hugely beneficial. And also from the point of view of time, that, for example, using a power vibrator, and there's different kinds, like I've got 3 different kinds here. Here's one, all right? Here's one. A little bit smaller. This is Maripol massager. This is a pulley massager. This is a new one, which is called a Pure Wave. Okay, and they have different features. Each of these actually has different attachment heads that can be exchanged, which create a slightly different effect as far as more penetrating or more general or what have you. You notice like this one has knobs, so it's like little fingers, okay? And notice that this one has none of that, okay? Also, this type of head is really good over clothes, okay? But if you're doing oleation, is really good for pushing oil on the body or pushing lotion on the body, that kind of thing, okay? They have variable speeds. See, it's a nice big motion, but it can go much faster and finer. The faster, sounds like a little airplane, okay? And generally speaking, the slower the motion, the deeper the penetration. The faster the motion, the more superficial, all right? There are many books published in the realm of physical therapy on the therapeutic benefits of vibratory stimulation. Many, many books, okay? In fact, probably using a vibrator, according to the medical anthropologist, was the first technical treatment, that first technical holistic treatment ever used in Western medicine was the invention of the vibrator, okay, which of course was used to treat hysteria in women, okay. However, I have also in my library, I didn't bring any out with me, but I've got physical therapist manuals for using vibratory therapy in physical therapy, and also using vibratory therapy in athletic performance, for example, okay. So for example, first thing is, because the cycles are at hundreds or even thousands per second, the impulse or the impact, okay, hundreds or thousands of times per second. Well, literally in 10 or 15 minutes, I can apply more pressure to the body than I could in a month of hands-on if I worked on them all day, every day. Okay? And so if we're talking about primary circulation, lymphatic drainage, if we're talking about inflammation, where the sports comes in is it's an absolute proven scientific fact that if you post athletic performance, if you use a power vibrator over the body parts that have been used the most in the performance, the hips, legs, glutes, calves, arms, chest, back, whatever it is, that the recovery time is cut in half. The recovery, the assimilation and removal of lactic acid, uric acid in the tissue, which is a byproduct of exercise, okay, is removed, is moved out of the body. And also, you hyperoxygenate the tissue. And there's a whole phenomenon which affects everything from athletes to Parkinson's patients, that if you flood the body with oxygen, the symptoms are reduced or go away. I know several docs right now who are treating Parkinson's using oxygen-based therapies. And the whole point is to hyperoxygenate the person. And for example, one of the things, the cutting edge, if you want to know on that particular therapy, I don't mind mentioning it, is you're using an oxygen with what's called a bag insulfation. So you have a big bag, because it's a low pressure system. You have an oxygen tank. The oxygen goes into a big bag. By big, I mean it's 4 foot long and 3 foot wide, and when it's inflated, it's about 2 feet deep. It hangs on the wall, okay? And then you have the hose and the mask that comes off of that. So you're not breathing the oxygen directly from the emitter. It goes into the bag first, and it's a low pressure system going into your ventilator mask as you breathe, and then you exercise while you're breathing the pure oxygen. The most common way that's done right now is on a stationary exercise bike. In other words, you get on an exercise bike, you have the mask for the oxygen, and you ride the heck out of the bicycle. And they found out that with stimulation and stress on the body while breathing the pure oxygen, that you get O2 saturation at up to 10 times the amount that you get in, for example, a hyperbaric chamber, which up to this point, hyperbaric chamber was the most sophisticated way to drive the most oxygen into the tissue is put someone in a hyperbaric chamber, crank them up to 2 atmospheres in pure oxygen, and they get saturated with oxygen, okay? Well, the funny part about it is the physiologists found that if we just have you breathe at ambient pressure, pure oxygen, but exercise and stress your body while you're doing it, that the O2 saturation goes up. It goes up higher and it goes up faster. Okay, and so I know about 4 clinics in the U.S. One of them has 20 of those stations for patients. Okay, my friend Dr. Angelique Hart, one of the top cardiac surgeons and post-heart transplant pacemaker recovery specialist in the country. Her office is in Santa Fe, New Mexico. It's called the Heart Center. Okay, Angelique Heart Center. Anyway, Angelique has now no longer using her hyperbaric chamber. That she's only doing stationary workstations, and they hook up O2 monitoring on the client's thumb to monitor the oxygen levels, and literally on the monitor you watch the oxygen levels just go like this. Whoop, whoop. Just watch it. Whoop, whoop, whoop. And they're sustained as long as they're on the bike, and they sustain for hours after they get off of the bike. It's amazing, okay? You could do it on a treadmill. You could do the same thing on a treadmill, but I can get a really high-end stationary bike for $1,000 or $2,000, okay? High-end treadmills, $10,000, 14,000, 10,000, 14,000. So I can have 2 or 3 or 4 of these oxygen stations for the cost of just getting a Triton treadmill, a medical grade professional treadmill, right? Now, here's the thing. But vibration also increases oxygen saturation. So if I vibrate enough of the tissue in a short enough time, then I get a similar effect. Now, granted, my client on the mat is not breathing pure oxygen, okay? In a clinical situation, I could actually do that. I could actually hook the client up to O2, and I could do my Thai yoga while they're breathing pure oxygen. Yes?
Do you need any special licensing to purchase?
Yeah, you're supposed to have a medical licensing, but for example, if you're working in a clinic, somebody has the right to do it, okay? As natural doctors, we can buy oxygen, okay? In fact, that's how I get my supplements made or whatnot. Which the rule for the laboratories is licensed physicians only. They recognize my ministerial license as a monastic doctor, okay? And so I can purchase supplies and I can have supplements made and so on. Not drugs, nothing invasive, okay? And so anyway, this is another way to increase the oxygen. All right, that's one. The other thing is that there are effects. In fact, we could have a whole conference just on the effects of vibratory medicine, okay? But for example, it not only increases circulation, it increases oxygen saturation, it reduces waste gases and salts in the tissue, lactic acid, uric acid, salts, and so on and so forth. But it's stimulating to the capillaries and to the veins, and it actually creates a self-regulating process to regulate blood pressure for the whole body. And it continues long after you're done. That's one of the really interesting, very cool things about it. Expedites wound healing by up to 30%. Okay. Now, you do not vibrate directly on a wound. Okay, so that would be a contraindication. Never ever use a vibrator directly on a wound, and that includes a bruise. Okay, what you do is you go around it. And using our theory of distal and proximal based therapy, okay, distal being applying pressure to the body as far away from the area of issue as you can and still find a relationship to it. And proximal being working as close to the site of the injury as you can without making it worse, right? So we follow that principle and we work around directly areas that are injured. Yes?
What about mosquito bites?
What about, we'll run right over them. I don't care, you know. And then the other thing is you can use the vibration to drive in an herbal or aromatherapy application of medicine. Okay, so if you have, here's one of the simplest ones that I do, is if I have an area that's inflamed or bruised, that I can take an analgesic, generic, fill in the blanks, whatever analgesic makes you happy, okay, whether it's Tiger Balm or whether it's one that you make, and I apply a little bit over the area that I'm going to work, okay, and then I vibrate the heck out of it and drive it in. And it is a different effect from iontophoresis, using electricity to drive it in or high voltage to drive it in, but it will still drive it in. And it's getting the deep effects at the same time. So what happens is the analgesic is amplified. The effect of the analgesic is amplified. Now, the caveat with all analgesics, just since I mentioned it, is you do not use analgesics over broad or big areas. You only use them on small areas, and actually I always say about the size of my hand. Okay, I don't want to ever put analgesic on the whole back, for example, or on the whole leg, for example. No. I pick the area that I think has the most pain or the most bruising or the most inflammation, and about the size of my hand, that's the area that I'll apply the analgesic to. And the reason why is because when you apply analgesics to broad areas, then they continue to work long after you're done, okay? And it's too much stimulation. Too much stimulation. Another effect of vibration is that it's irritating to the body, but the irritation is happening faster than the body can adequately respond. And so there's a shift that occurs in the nervous system because of that, and you get a healing response. You have less pain and you have increased circulation. That process is called counter-irritant reflex response. Counter-irritant reflex response. Now, some scientists say that's the primary reason acupuncture works, is that acupuncture needles are irritating. Your body doesn't like to be pierced. It's unnatural for your body to be pierced. It's natural for you to avoid things that are sharp or pricky that would put holes in your body. That's innate. That's instinctive. Every person in the world, if you walk up to them and start to push something sharp into them, will jump away from you, and some of them will then try and chase you down the street and hurt you just because you tried. Okay? Because it's so irritating. All right? And so one of the primary scientific theories about how acupuncture works is that the acupuncture needles are so subtly irritating and yet unavoidable, because you've pierced the skin, you've pierced the subcutaneous tissue, you may pierce the muscle, and you can't get away from it. There's no way that part of your body can get away from it. And so what happens is the body has to deal with it. And so there is a counter-irritant reflex. And that counter-irritant reflex looks like less pain and more circulation, better communication with the body part. Parts of the body that I irritate actually are calling for more communication from the innate. And so the innate sends more attention there. That part of the body that I irritate for a moment or two is more conscious. Let's put it that way. The part that I irritate is more conscious. Okay? And so initially, the attraction of consciousness is a response to a direct interference or irritation. Okay? But it's one of these deals that while the innate is there, why don't we go ahead and fix something? Well, since we're here, I had to come in here and turn all the lights on. Now I see all the dust bunnies. When I just go through the room and grab something and exit the room, I don't really realize the little dust bunnies and the cobwebs and the little disarray of this and that. And there's something actually completely in the wrong place in the room. But I come in the room and I bring a little more consciousness to it because I thought I heard something in the room. Or there's a problem. I think there's a problem in the room. So I come in, what do I do? First thing, turn on all the lights. And all of a sudden, because I'm now more consciously inhabiting the room, I'm more likely to see what might not be right in the room. And heck, while I'm here, I'm just going to go ahead and tidy up a little bit. All right, now think of this as the response to the irritation that the innate is doing. And that so much of what we do is actually subtly irritating. And that actually the healing response is directly because it's subtly irritating. So vibration is subtly irritating also. Okay? It can also be very lusciously, deliciously feel good. Okay? But either way, it's drawing attention, right? I'm also going to pay more attention to something that feels lusciously, deliciously good. Almost as much or more than if it's just flat out irritating. See, it doesn't matter which side of the continuum you're on, right? Irritating, delicious. Both draw attention. It's the middle part we try to avoid. The one thing I don't want my clients to do in session is not really know that I'm doing a session. If my session is so soft and so comfortable and so whatever that the client immediately checks out and they're not even present to what I'm doing, okay? Technically, it might be restful for the client. In other words, they're going to say, wow, that was the best nap ever. Facilitated nap, okay? But on the therapeutic side, not so much.